What's up, guys? Watch your steps.
Good morning. My name is Gordon Peters. I'm the Deputy Grand Chief of AIAI, the Association of Iroquois and Allied Indians. In 1977, the federal government had a report from one of its contractors that said that they advised that the water problem in First Nations was acute and that there needed to be an influx of capital. Almost 40 years later now, we have the first influx of capital that comes via the Prime Minister, who announced $1.8 billion for boil water advisories. We have a report which you currently have. When we wrote this particular report, all of our communities didn't fit the criteria. They didn't fit the 1-year water boil advisories, nor did they make advancement in the ranking system in order to be able to move towards having construction. So the problem that we face is both the ranking system and the process. We have a lot of promises, we have underperformance, and we have a lot of variation in the process right now that we're not really clear about what happens and how it's going to happen. The commitment that we have from the federal government right now extends 2 years beyond their mandate, and the federal government itself, it says right now that 2/3 of the allocated money remains unspent. And so what it says to us very clearly is that even though we can move from where we're at right now to a new list, doesn't mean that we're actually anything is going to happen to us unless the new government, any new government that comes along, continues to maintain the water requests and the finances that are there. 1.4 billion was also set aside at the time for monitoring and testing, and I'm assuming that's going to be some of the O&M. So if you see our report that you have, there are several issues that I think that we need to resolve. Some of our solutions are this. There should be no a step-by-step ranking system. It should be abolished, and if there's bad water, immediate action should be taken to establish bad water. We're asking the federal government to work with us to resolve some of those problems, and so that going forward, there are opportunities for all communities who have bad water to be part of this process, not just boil water advisories and not just a ranking system. The ranking system is a cost containment process. And so for us today, we're bringing our chiefs here today to tell you firsthand some of the issues that you have. So I'll call to the mic first our Donald Maracle, who had just been recently added to the boil water advisory, and have him say a few words.
Sego Sabagwego. Chief John Maracle, Mohawks Bay Quinte. We're the third largest First Nations in the province of Ontario, the largest nation in AIAI. Currently, Ontario has 65% of the boil water advisories, and in terms of having the money to address the need that's in Ontario, they get about 12.5% of the national resources while having 22% of the population. In my community, 80% of the wells suffer water shortages chronically all year round. We have half the community serviced with a water treatment plant and also through a municipal type agreement with the town of Toronto. But there still are 547 wells. Almost half of them are polluted or experience chronic water shortages. We have 102 shore wells along the Bay of Quinte. They suffer from blue-green algae in the late fall and summer. As a result, the medical officer of health says issues do not use orders. So safe drinking water is the cornerstone of public health, and First Nations in Ontario lack that cornerstone. Recently, there have been 24 more communities added to the boil water advisory list, and 15 of them are in Ontario. So the federal government has to put more money into Ontario if these needs are going to be addressed. And I would certainly ask the Canadian public to support the human right to safe drinking water for First Nations people. Thank you.
Yep. Good morning, Chief Denise Stonefish, El Napawi La Kawit, Delaware Nation. Currently, we have a water distribution system in our community. It's 20 years old. It is over 20 years old. It's lived past its life expectancy. And the aquifer that we're drawing it from is inconsistent, and it is in high content of barium and sodium, which causes a major health concern for a significant number of our citizens. We have the opportunity to enter into a municipal type service agreement with the local municipality, and we're not on a boiled water advisory, but we want to be proactive rather than waiting for a crisis to arise, which could very well be imminent within a 2-year frame. We believe that this municipal type service agreement will be cost effective for the federal government, and rather than building a new system, which would cost about $50 million, we're looking at a cost savings of 1/3 or less. Again, while we're not on a boiled water advisory, I think we need to also take a clear message from the animal world. And no joking, my pet dog won't drink the tap water. So what does that say? We should listen to them too. Thank you.
Ani bojo wawash keshtodem megaze kwedishnikas Laurie jaganash nozwin Michisage Anishinaabe and Dao. Gima Hiawatha. My name is Laurie Carr, and I'm the chief for Hiawatha First Nation. We are located on the north shore of Rice Lake, and our water issues include dry wells and unsafe drinking water. The criteria that Canada has set out for ending long-term boil water advisories leaves my community of Hiawatha off the list, and they have set a criteria of 1 year of consistent boil water advisories, and because my community runs on individual wells, we do not meet their criteria. And over the past 20 years, we've had several feasibility studies done by INAC, yet we still cannot meet the criteria to even get on the list. So we are working on an interim solution. However, this is only interim, and in the meantime, our citizens are putting chlorine down the wells to fix any immediate problems, or they're buying water. And again, we are just 20 kilometers southeast of the city of Peterborough, and yet we cannot have safe drinking potable water. Thank you.
Harvey.
Bonjour, Harvey Bell, Batchewana First Nation. I'm sitting in for Chief Dean Sayers. We have a geographic situation in Batchewana where our reserve is split into three different areas where our people reside. And all three of those areas have trouble with their wells and not very good water. In fact, all three of them as well are being supplied with bottled water. Our residents just don't trust the water that they're getting from the well systems that they're on currently. So there is a great need. We need a system One of our areas is about 35 miles north of Sault Ste. Marie, and the other one, that's the Gouli area, and the other one is Batchewana, or the Batchewana Bay area. It's about 50 miles north of Sault Ste. Marie. So all those areas are in dire need of good quality water. Oh, Chimiquech.
Saguli Sagwik, there was like getting young gets when you daaga, then we'll go Honjoda. Grand Chief Joel Abram from AIAI, and I'll be speaking on behalf of Oneida, from Oneida, and former chief there as well. And Oneida is a population around 2,300 people on reserve, and our current water treatment facility is the same design as Delaware Nations, and they currently do not meet the Ontario standards for drinking water. We had an assessment done by Aqua a few years back, and it does not meet the current standards at all. We're a GUDI plant, which means groundwater under the direct influence of surface water, so the quality of the Thames River directly affects the quality of our water, and we're actually downriver from the third worst polluter of water, municipal polluter, which is London, Ontario. Whenever they have a stormwater surge, partially treated sewage flows directly into the Thames River, and we're directly downstream from that. So our current treatment system can't really deal with those kind of situations. We have had a lot of boiled water advisories in the back and in the past when turbidity levels increase, and so just different concerns with respect to that. So we're also looking for a lot of assistance in respect to water and having quality water within all of our communities, which is a great concern to us. Thank you.
Thank you. That's the end of our comments, and I think I leave you with the one thought, is that, as I said when I opened, I said, most governments that we have dealt with, they have overpromised, they've underperformed, and they've underspent. And the Parliamentary Budget Officer released a report last year, said that what INAC sent back to Treasury Board over a 5-year period was $1 billion. And so there is a tremendous need for water, clean, safe drinking water in our communities, which is a human right. And that human right should never be in question. It should be automatic. And so that's what we're here to tell you today, is that this government needs to really make sure that they move faster, quicker, and address all issues, not just a chosen few. Thank you. We're open to questions.
Last week, Minister Philpott did a long presentation. She added 24 communities to the long-term boiled water. There's now 91 of them. And she still promised that there was going to be zero by the year 2020. So you're saying that some of your communities don't fit under those criteria?
No, they don't. I think all of our communities probably didn't fit under that criteria, and we don't know what the new criteria is for taking on 24 communities. So they haven't told us what that criteria is and why they've added those. There's a lot of arbitrary decision-making that goes into this process. So when they said they're taking 40 communities off the boil water advisory, we try to find out, what does that actually mean? Does it mean that they have now safe drinking water? Does it mean that they've signed an agreement to begin construction? What does it actually mean? And we haven't been able to find that out.
Discussions also at that same press conference, Minister Philpott introduced her new deputy minister, Mr. Tremblay. Has there been any discussions yet with her department and her deputy minister?
We haven't had it. We have over a significant period of time, both with Minister Bennett before the departments were divided, and there was been some higher level meetings with Philpott on a regional basis, but not with us directly. We asked for a meeting while we were here in Ottawa lobbying, but we haven't been able to secure that meeting. But the issues that we're talking about are well known. And there have been study after study that has indicated the problems that we face. And so, as you know, the plan that they have is actually 2021, which means that it's 2 years beyond their current mandate. And so unless there's a new government that comes in, and unless they get back reelected, or a new government who says, yes, we're going to continue this on, we may go back to the old style of following that ranking system that we had before.
So I take it you're hoping that you can lobby enough so that by this budget, which is later this month, you can get that money for infrastructure?
Yes, infrastructure affects everything in our communities. If you don't have water, it affects our health centers. Housing is a problem that we have in our communities. Access to capital is huge, and it limits our growth. It limits our development in the communities, and so we really need to be able to pressure government to continue to do as much as they can, because housing has been left on the sidelines. There's no significant housing movement that's going on right now. The public water infrastructure that they're talking about are areas that should have been connected, but were never got connected by INAC in the beginning. And so those are some of the things that they've committed to be able to follow up on. But definitely, there needs to be more capital and access to capital on a regular basis so that communities don't have to fit certain criteria to move ahead if they got bad water. Bad water needs to be replaced immediately.
How would you, I guess, prioritize, especially communities up in Northern Ontario? They're really they need to get their water systems up and running because sometimes they don't have anything whatsoever. So are you suggesting you have your water done at the same time?
Well, currently, most of the investment to date has been in Northern Ontario. It's the South that's being left out. We had a meeting on January 5th in our community with Minister Philpott, and she said that will change. And so we're hoping that there'll be an investment that it's inclusive of all the First Nations in Ontario. Also, in the former ranking system, before there were water treatment plants, if people had contaminated wells, they would be eligible to get a system. Now the most of the money is only being spent on remedying the plants that have already been built. On the O&M side, most of the money that's there goes to support the O&M for plants that are already built or to replace them. And so the ones that haven't got a plant or need a plant have been on a waiting list now for decades at the great expense of the public health and safety of their citizens. So contaminated water will make you just as sick in the north. It will make you just as sick in the south and the east and the west. You know, it's a health issue, and it needs to be approached in that manner.
More questions?
Any other comments somebody wants to make?
I guess in closing, we all heard about the child welfare meeting, the national emergency meeting on child welfare last week, and the ministers, both ministers Philpott and Bennett, wanted to make that a priority. In Ontario, one of the things that we've always said is that we want to focus more on prevention and also on family well-being, and for child well-being, the family must have well-being as well. In order for a family to be well-being, there must be investments in housing and infrastructure like water. So you have to have good drinking water. You have to have a clean, safe place to live. And so those things that are sadly lacking nationally. So although we heard a lot of commitments on the reform side of child welfare, we didn't hear a lot on the investment side in terms of family well-being, in terms of those capital investments that we all need to make sure that the kids can have a safe place and safe drinking water. Thank you.
On the issue of taxation, the Grand River Enterprises at Six Nations manufacture cigarettes. They pay Canada $250 million a year in excise tax. Yet there's not near that amount of money goes back to that community, and that's one of the communities also that needs water lines. A lot of those cigarettes are sold in our communities, $600,000 a year. Not one penny of that excise tax money comes back to help us get water in our communities.
One of the things that we did want to address while we were here is that we strongly believe, and a lot of these issues have gone through the court, some are still going to the courts, is Canada's legal and constitutional obligations that they have. And yet, when they come to us, you can't do a major project in a community without having to put up money. And so some places it's as high as 80-20, sometimes it's even higher than the 20% that you're required to be able to pay along with the federal government. It varies across regions. Some regions they pay 100%. This region, you have to pay that 20% or higher, as I indicated. Part of our lobby is to get rid of that 20%. The government has an obligation to have an obligation. Obligation doesn't exist because we're gonna pay that extra 20% to support them. And so while we want clean drinking water and we will work and we will support everything that needs to be done, we think there's an obligation on Canada to do that.
That's it? Thank you very much.
Thank you.
Thank you very much, everyone. And everyone has a copy of our water study that we've done. And in the back, you'll find a series of recommendations that we will be lobbying on and hope for change. So, Inishik.